All right. Thank you, everybody, for joining us for the fourth in-depth webinar in our community-based social marketing series. We're going to be looking more today at piloting and evaluation. Again, a reminder, this webinar is being recorded and we will make it available along with the rest of in the series on the Communications Work Group website on ChesapeakeBay.net. So I'm going to pause there and then turn it over to Katie Phelps from Action Research to start.
All right, great. Thank you, Rachel. So as Rich mentioned, we're going to be talking about piloting and evaluation today. This is part 4 of a webinar series. Coming to a conclusion here. First, I'd like to thank our funders. So this project has been funded wholly or in part by the United States Environmental Protection Agency under an agreement with the Chesapeake Bay Trust. The contents of this document do not necessarily reflect the views and policies of the EPA, nor does the EPA endorse trade names or recommend the use of commercial products mentioned in this document. So Jennifer and I are from Action Research. We're an organization that applies marketing and social science research to outreach programs that promote safe, healthy, and sustainable communities using the best practices of social science and community-based social marketing. As Rachel mentioned, this webinar is being recorded. If you haven't already, please mute your phones so we don't get any background noise or ringing tones. If you haven't already watched it or were part of our one-day training back in October, there is a CBSM overview that's available on the communications website as well. This 1-hour overview helps set the stage for these in-depth webinars, so good to review that and really understand that before you dive into these. We're going to have Q&A at the end or throughout. There's a chat box available as part of this webinar, so please put your questions into there, and we will address those either ongoing or at the end, depending on the question. This webinar series, we've covered behavior selection, barrier benefit research, strategy development, and today we're finally on to pilot testing. So your speakers today are myself and Jennifer Tabanico. I got my master's in behavioral science with a focus specifically on environmental science from the University of Michigan School of Natural Resources. I've worked at Action Research for over 7 years as a project manager on a variety of topic areas: water conservation, energy, forestry, other types of conservation, all applying behavioral science to those techniques. As a graduate student, I actually worked in the Chesapeake Bay helping promote behavioral science and strategic program design and evaluation as part of my graduate work. So this is very coming full circle for me, getting to use the knowledge I've gained as a professional to help further those goals that I really started my professional pathway with. So I'm really excited to continue to work with this audience and help organizations in the Bay be more strategic about their behavioral change programming and really make effective and meaningful impacts on the various problems that affect the Bay. Jennifer Tabanico is the president and co-founder of Action Research. She has a master's degree in experimental psychology and more than 17 years of experience developing and implementing community-based social marketing programs for public and private agencies. Her work spanned a broad range of issues, including hazardous waste, pollution prevention, transportation, water conservation, energy, public safety, you name it, she's probably worked on it. She's been published in a variety of outlets, including the Journal of Environmental Psychology, Social Influence, Biocycle, Criminology, and the Handbook on Household Hazardous Waste. And she also teaches behavior change strategies for sustainability at UC San Diego Extension. So we're going to be tag teaming this presentation today. Jennifer's going to be taking the first portion, and I'm going to be taking the second portion. So we're going to be talking today about community-based social marketing. As mentioned, there's a 1-hour overview, so I'm not going to spend much here on the larger picture, but to go real quickly, community-based social marketing has its origins in social science, really focusing on how we can create programs that are community-based and really remove barriers to behaviors that we want people to do that help promote healthier, safer, and more environmentally healthy communities. And we really focus on how do we change behavior rather than just on education and awareness. because while it's important to give people awareness of issues and educate them, what we see in the social sciences is often those two things alone are not enough to really get people to change their actions. So community-based social marketing is a 5-step process, starting with selecting a behavior, which we talked about in webinar 1, which is where we set in a particular environmental goal and figure out what behaviors have the most impact on it, and how do we prioritize which behaviors we want to learn more about. Then moving to barrier benefit research, which is where we try to understand why people aren't already doing these behaviors and not making assumptions about our audience, really digging into what barriers should they face, be they perceived or real, and how can we assist them with those, what benefits are meaningful to them, not to us. Then we develop a strategy using those barriers and benefits. So what social science tools, marketing tools can we use to really overcome those barriers and address them, and frame behaviors around the benefits that are meaningful to our audience, not to us. Finally, what we get to today is pilot testing, so taking those different strategies that we develop and putting them in the field, seeing how they work in a small-scale situation before we take them to the last step, which is implementing broadly and evaluating. So today, as mentioned, we'll be covering those last 2 steps. So I'll turn it over to Jennifer now to talk about pilot testing.
Great, thank you, Katie, for the introduction. So I'll just provide a quick overview here of what we're going to cover with the piloting and evaluation steps. As Katie mentioned, it takes us a while to get here, so there's a strategic process around behavior selection. We do research around barriers and benefits, and we put all this work into developing strategies. And this is a step that is very often skipped. We've done all this work up front, we're excited about our strategies, and maybe we're under a time crunch and we really just want to get going and get a program on the ground. But what I hope you will see today is not necessarily, we don't expect you all to become experts in experimental design or pilot testing, but really I'm hoping that you can see the value of pilot testing in terms of ensuring that your strategies are effective before rolling them out. And then what Katie will talk about later is what to consider in longer-term evaluation of the program into the future. So I'll start with some basic definitions that you may hear when we talk about pilot testing. We'll talk about metrics that could be used, experimental design, so some different ways that you could set up a pilot test and the pros and cons of each. As we'll try to point out, there are sort of Cadillac versions to do this. There's large maybe experimental designs that would be subject to peer review and really strong, and you can be perfectly sure about your conclusion. But then there's other designs that maybe are have some more real-world constraints that you have to consider. So at any level, we hope that there's something that you could find here to be able to test your program, and just knowing what the pros and cons of those different approaches are. We'll also cover briefly how to calculate return on investment. So sometimes a program works, but the cost of delivering the program maybe doesn't justify expanding it and implementing it broadly. And then lastly, Katie will talk about how to put together an implementation plan and an evaluation plan to set you up for ongoing success, to ensure that behaviors sustain, that you're making good use of budget, and that you're making adjustments as needed into the future. So starting with some definitions, first broadly, what is a pilot test? A lot of times when we hear people talk about pilot testing, what they mean is that they've developed the strategies and then they put it into the field for a year or two, and then they waited to see kind of what happened. And that's not what we mean when we talk about pilot testing. In the context of community-based social marketing, pilot testing is typically short-term with a small subset of the population, and it's done in a way to give us preliminary data about the efficacy of one or more strategies. And so this isn't implementing it for a long term and seeing what happens. It's implementing it long enough for the behavior to happen. So depending on the behavior, it might be very short term. If it's something that a purchasing decision, such as purchasing a tree, that might not take as long as something like installing a living shoreline, when there's contractors that need to be scheduled and a longer time frame for that to happen. So the time frame is determined really by the behavior, but typically this is the shorter term, not long-term program. The primary purpose of conducting pilot testing, as I stated in the previous slide, is to identify and address any problems. So sometimes we hit problems with implementation that maybe we didn't expect. Maybe there's some community pushback that we didn't anticipate, or a reluctance among community members to accept program materials, or other glitches in delivery of the program. And so it allows us to address those problems up front, which is a lot easier to do on a small scale than once you've rolled it out across an entire neighborhood or an entire city, entire town, or county. It also allows us to test different program variations. So you might have one variation of the program that's a bit more expensive. Maybe it involves in-person delivery, maybe there's an incentive involved, and that can be tested against less costly variations of the program, maybe one that doesn't have an incentive, or something that's delivered more passively through the mail. And that can wind up being very valuable in terms of making decisions about broad-scale implementation, and we'll cover that a bit later. Third, pilot testing, even though it's skipped because it does add to the overall cost of delivering the program or conducting a community-based social marketing effort, adding that step adds cost, but in the end it's a cost savings mechanism because it allows you to identify strategies that are effective and also cost effective. But more importantly, it ensures that you don't spend your program implementation dollars implementing a program that doesn't change behavior. And so if you think about the return of investment on a program that doesn't change behavior, that return on investment is zero. So in the end, this can really save the program money in the long term. And then lastly, pilot testing allows you to evaluate that return on investment. And again, we'll cover that a little bit later in the presentation. Two places where pilot testing is useful. First, in that fourth step, we pilot test our strategies. And if they don't work or they're not cost effective, we can go back and refine those strategies and then pilot test them again. Again, this is short-term pilot testing. So we can maybe go back to our strategies and ask ourselves, did we overcome all of the barriers? Are there elements that might need to be added into the strategy, or are there elements of the strategy that maybe don't highlight the benefits in the way that they should for the target audience? So we can go back and refine our strategies, pilot test them again until we get the effects that we're looking for. The second place where pilot testing helps is that if you've pilot tested strategies and you're just not getting people to engage in the behavior, rather than implement that program, it suggests that maybe you should be going back and thinking about whether there's other behaviors that are likely to be more successful in terms of their promotion. That doesn't happen very often, but it is a decision point that you can consider before, again, implementing a program that's unlikely to be effective. So two other definitions I wanted to discuss here because they're often used incorrectly, and you may hear them when you're working with consultants or even internally, and that is random selection and random assignment. These are two of the most important terms when you're constructing a pilot test. And even though they sound similar, they're very different. So first, just very briefly, random selection refers to how our sample is drawn from the overall population. So if you look at an entire county or an entire state or an entire town, random selection is how you determine who gets into the study, who's getting into the pilot study. Random assignment, on the other hand, is how those people that are selected to be in the study are assigned to different groups. And that group might be a treatment group that gets one of the different strategies, or it might be a control or comparison group that doesn't get exposed to the program materials. So again, random selection is how you choose people to be in the study, and random assignment is how you choose what groups to put those study participants in. So I'll talk about those in a little bit more detail in the next few slides. So first, random selection. And because this is a pilot test, we don't want to be delivering the strategies to the entire population, but we do want to be delivering the strategies to people that represent the larger population. And so when we're selecting the people to be in the sample, we should be selecting those people in a way that's representative. So how do we do that? So if you looked on the left here, those different bugs, butterflies, ladybugs, and such are going to represent our overall population. So imagine this is the entire population of your town. It might be your entire population of your workplace, your county, your state, whatever it is your target audience is, this represents all of those people. And the way that we would select, we could just take, the first people on the list or the first bugs on the list there, but that might not necessarily represent the larger group. There might be more ladybugs that show up in the top of the list compared to bees or grasshoppers. So we have to do this in a way that's representative. And the way that we do that is first we number the entire population from 1 to 10,000, 1 to 48 in this particular case. So every individual unit in the population is assigned a number. We then randomly select numbers that pertain to the number of individuals we want in the sample. So those random numbers can be selected by throwing all of the numbers into a hat, figuratively or actually, and pulling those sheets of paper out that represent those numbers. There are also programs that you can use. Katie will provide some of those links at the end of the presentation. But there's websites like random.org that will randomly generate numbers for you. You tell it how many numbers, and then it creates a list of randomly generated numbers for you. So different ways you can do that, but really important that those are made randomly. So imagine we want a sample of 9 people, or 9 bugs in this case, to be in the study. We would randomly select 9 numbers from that overall population, and that would represent our sample. When we do this at random, the idea in most cases, particularly if your sample is large enough, is that you should have equal representation of different groups in that resulting sample. Sometimes, however, it becomes really important that you have different groups represented. So maybe you want people with different sizes of property need to be represented, and you want to ensure that they're represented. And when you draw samples at random, theoretically, you should get equal numbers, or you should get numbers that are proportional to their representation in the population. But sometimes, if the sample is not large enough, things can be skewed. So you might wind up with more large property owners and not enough smaller property owners, or more coastal property owners and not enough inland property owners, or people with higher incomes and not people with lower incomes. So depending on what your behavior is, and if you need to really want to make sure that you have those different segments of the population represented, then what we do is conduct a stratified random sample. And so what you do here is you divide the overall population into smaller groups or strata that are formed based on some shared characteristics. And the importance of those shared characteristics depends on the behavior that you're studying. It might be ethnic characteristics, it might be income levels, it might be property characteristics. Whatever is important to your topic of study, we divide the population into those strata, and each individual is in one and only one of those strata. And if those strata are then equal, what we do then is randomly select individuals from within each of those strata. So in this case, we would select 3 people from the ladybug strata, 3 from the bee strata, and 3 from the grasshopper strata. And in that way, we know that each of those groups are represented equally. And this allows us to ensure the balance and also allows us to be more precise in our estimating. Sometimes, however, those strata aren't equal. You might have more people with larger properties and fewer with smaller properties, or distribution of income level is variable. When that's the case, the first thing that you do is figure out what are the proportions out of 100% of each of those strata. So in this case, the butterflies represent 40% of the overall population. The grasshoppers represent 10%, the bees represent 20%, and the ladybugs represent 30%. So by what we do then, assuming out of that 100%, is we select people out of the population using random numbers that represent that proportion. So if 40% of the population are butterflies, we then need 4 butterflies. If 10% are grasshoppers, we need 1 grasshopper, 2 bees, and 3 ladybugs. And so in this way, you've drawn a sample that represents proportionally each of those different strata that you're interested in. So again, random selection is the way you choose individuals to be in the study. What's most important is for pilot testing then is how you take those individuals that are going to be in the study and assign them to the different groups. And that is random assignment. Random assignment ensures that each member of the sample has an equal likelihood of being in any one group. So say you took the first 20 people who signed up to be part of the study, and you put the first 10 people in one group and the last 10 people in another group. What happens is when you do that is that there could be pre-existing differences between the two groups. There might be something about the first 10 people who showed up that's different from the last 10 people. Maybe the first 10 people are more knowledgeable, they're more on top of things, they read the news more, and the last people are maybe a little more apathetic. And so you may have those pre-existing differences that could potentially explain any differences or lack of difference that you find between the groups. So with random assignment, we are able to eliminate that and ensure that every individual has an equal opportunity of being in any one of the strategy groups. So the way in which we do this is essentially line up our entire sample, and then take each individual unit and through a coin flip, in the case of 2 groups, randomly assign them to, so if you flip the coin, the heads group goes into group A, and then the tails group goes into group B. And so for each individual, you flip a coin, essentially, and put them into one of the 2 groups. If you have multiple groups, then you would essentially have them figuratively or actually draw a number out of the hat that represents maybe it's groups 1 through 7 or groups 1 through 3, so that each individual has an opportunity of being in any group, the control group or a treatment group. So in this case, imagine if you have 20 people in your sample, just going from left to right, you'd flip the coin. And when you do this enough, most of the time, you're going to wind up with equal numbers of individuals in the group A and versus group B, and the representation of that group will be equal. So you should wind up, for example, with equal number of people who are likely to be early and equal number of people that are likely to be late. So they distribute evenly across those 2 groups. So the idea in doing this is that the 2 groups at the start are similar and that do not have any pre-existing differences between them. So I mentioned this, alluded to this previously. When you assign people to groups, in pilot testing, there's typically 2 different kinds of groups. First is what we call the treatment group or the intervention group. And this could be multiple groups. These are the groups that get the materials. These are the groups that get a strategy or some variation of a strategy. The control group is the group that doesn't get exposed to the program materials. Sometimes that control group can be an information-only control group, so maybe they get information about the program, but they don't get any of the additional strategy tools like commitments or prompts or incentives, personal visits, those types of things. So the control group typically gets nothing, but at times we would have them be an information-only control group. Moving on then to some different types of program design, so some ways that you can set up a pilot and a discussion around the pros and cons of each. So I'm going to cover 5 different types of designs. Again, the goal here isn't to make you an expert in experimental design. These are covered in depth in graduate level courses. There's whole courses or whole courses of study even on experimental design. But really what I want to do here is just expose you to some different options so that if you're working internally or you're working with consultants, you can make decisions based on your own internal constraints with time or budget or audiences or even behaviors that might direct you to one or another. One of the most common forms of pilot testing that we see, but happens to be the weakest form of pilot testing that you can do, is a one-shot case study. And essentially what this is you have one group, so you haven't done any random assignment to conditions. You have one study group, and you deliver the program to them, and then you measure some results. So maybe you hold a workshop with people who signed up, and then you give them a test at the end to see how they did or what their behavior, what they know or what behaviors they report they're going to do. Or maybe you mail materials out to the community, and then you see who shows up at, say, a tree planting event, and you count them. So the challenge here, and what makes this the sort of weakest design, is that you really cannot determine whether people changed, because we know nothing about how they were before they came to the program. So it's possible that the individuals that you tested or measured at the end were going to do that anyway, whether or not they were exposed to the program. Or they may have already been engaged in those behaviors before they were exposed to the program. Because there's no baseline measurement, we cannot determine whether people changed, and we most certainly cannot determine whether they've changed because of our program. So you should almost never be doing pilot testing with this sort of design. This type of design really is oriented more around identifying implementation challenges. So it would be appropriate if you're concerned that maybe participants aren't going to be willing to sign commitments, or they're not going to engage with your door-to-door outreach. This would be good for what we might call a pre-pilot to test engagement, but not for evaluating the efficacy of your program. The second type of design is called a one-group pre-test, post-test design. This is stronger than the one-shot case study in that it involves a pre-test. So we now know something about how the participants were before they were exposed to the strategies and how they are after. And so now we can be a little bit more confident that people did experience some level of change. The downside here is that even though we can detect that these participants changed, we cannot be certain that they changed because of our program. And there's two primary reasons for that. One, we call history effects. So there could be other things that happened between the pre-test and the post-test that are other than your program. So they could be changes in political climate, public health climate, finances, other programs, weather. There are multiple other things that could happen that confound your ability to be able to make a conclusion. So you can determine whether people change, but you can't necessarily determine whether they changed as a result of your program. The second thing to be concerned about here are what we call maturation effects. Maturation effects are changes to the individual, changes in the person that occur between the pre-test and the post-test. So maybe they've finished college, maybe they've gotten jobs, maybe they've had some other life transition, they've retired. So there's changes in the individual that occur between pre-test and post-test. If pre-test and post-test are done relatively close together, that's less of a concern, but depending on the behavior and the bigger that window is, the more you might subject yourself to those maturation effects. Here's a slightly better design here, and one that is very often used. This is called a static group comparison. In this case, you take two groups, and you haven't random assigned them to groups. So maybe group A is town 1, and group B is town 2, or neighborhood 1 and neighborhood 2. And you've identified two pre-existing groups, and you've given one the program, and you've not given the other the program. And then you deliver a post-test. When you do this, we have the same issue as before, as we had no baseline. So we don't know if those two groups were similar at the start. So if we see that these two groups were different on our post-test, maybe the program participants are engaging in the behavior more than the no program participants, we can't be confident that that difference is because of our program, because they may have already been different from the start. There may already have been things about those two groups or those two neighborhoods that were different before they got the program. We can very easily address that, however, by adding in a pretest and then randomly assigning those those individuals or towns to group. So in doing that, if we've pre-tested and we've ensured that Group A and Group B are similar at the start, we've delivered the program to one group and not to the other, and then we've tested at the end, what we've done here is eliminated a lot of those other concerns like history effects and pre-existing differences. So with this type of design, we can be much more certain that any difference that happened from pre-test to post-test is a result of our program and not some other external situation or external factor that happened at the same time as our program, because Group B would have been exposed to that also. So this is one of the strongest designs and one that we very often use in evaluation of our work. So what data from this might look like is, say you have your treatment group here. This allows you to see your treatment group and your control group were relatively the same at the pre-test, but they were different at the post-test. So the treatment group maybe is applying fertilizer less frequently, or they've reduced the behavior that you're trying to reduce, whereas the control group stayed relatively the same. Maybe they reduced a little bit because of weather issues or other external factors, but they didn't have the drastic change as much as the treatment group. One step up from this, again, if you have this capacity to have two groups that are randomly assigned and you have the capacity to pre-test, deliver the program, and then post-test, you can strengthen that by conducting an additional follow-up. And what that additional follow-up does is allow us to determine, did that behavior persist beyond the intervention, or did it revert back to normal very quickly? And multiple follow-ups are useful if possible. Also using this design, that pre-test, post-test control group design, as I mentioned earlier, you can assign different groups to receive different strategies. So you still have that control group that doesn't get the strategy, but you can have 2 or 3 or as many as you can, other groups that allow you to test out different variations of the strategy. Why would you do that? Because sometimes some strategies work well and other strategies don't work as well. So again, looking at what that data might look like, at the beginning, pre-test, you have your strategy A, B, C, and D, and control groups all looking about the same in terms of their engagement and the outcome of interest. But then at post-test, maybe you see that strategy B, strategy D didn't really change much, and neither did the control group, but 2 of your strategies worked rather well. And so, again, this allows you to make decisions about what you should be rolling out on the long term. Another interesting design, and I know this is kind of small here, but I'll show you another slide. Another interesting design that we sometimes need to consider is a staggered baseline, or what we call a delayed treatment design. These types of designs are most often used when people need to sign up to be a part of the program first. So maybe they need to sign up to, or they have expressed some interest in participating in a community peer-to-peer program. So Katie and I did some work a while back with energy challenge workshops, and they were sort of these community teams of people that were working on energy efficiency in their homes. So people were already signed up. This also works well if they're pre-existing groups. So maybe they are neighborhoods that are separated geographically, and everybody needs to get the program at some point. But how do we pilot test that, or how do we keep those neighborhoods separate? So with the staggered baseline design, essentially each group serves as a control group for the group before it. So your initial sample is, say, all households who are signed up for the program, and then you randomly assign them to be either part of a treatment group, which is the group that goes first, or what we refer to as a wait list control group. So by putting them in a waitlist control group, we already know that they are people who are likely to sign up for the program. They are interested, they're motivated to engage in the behavior, but we're just going to not let them participate yet. And what that does is minimize pre-existing differences. So if we just took people who signed up for a program and compared them to people who didn't sign up for the program and used those non-sign-ups as our control group, there could be really big differences between people who are interested and people who are not interested. So that is not a good comparison. Whereas using the waitlist control, you've taken people who are interested and you've just delayed their participation. So the way this works, you can have one waitlist control, or you can have 10, 20, 30 waitlist controls, depending on the program. Is you conduct with your treatment group as you would. So you do a pre-test, you deliver the program, you do a post-test, and then perhaps a series of follow-ups. With the waitlist control group, you continue to collect baseline measurements from them if possible. If it's something like water use or energy use or observable characteristics, maybe there can be an ongoing baseline. But if otherwise, you conduct their pre-test at the same time that the previous participants are conducting their post-test. So then you make that comparison between their pre-test, so an interested group that has not participated, and the treatment group's post-test. So that middle block of blue and yellow would be your first comparison. You then deliver the program to the waitlist control group and then compare their post-test results to the pre-test results of the following group. So in doing this sort of rolled out design, it allows you to have that waitlist control serve as the control group for the group before it on an ongoing basis. When you continue to see differences between the first group and the second group, then the second group and the third group, and you see that pattern of differences over and over again, you can be confident that your strategies are working well. Here's another way that kind of graphs that out. So along the bottom is your timeline. So this is, say, from January through, it covers like a 1.5 year time period that you're gathering some baseline information. Maybe it's a water quality data, maybe it's observations of landscape, maybe it's number of trees on their property, but you're gathering some baseline data from all of your groups on an ongoing basis. You then deliver the intervention to one group, and then you conduct a series of follow-up measurements, and then to the next group, and the next group, and so on. And what you see, if your strategy is working well, is that you've delivered the intervention to one group and you see a reduction. That would be like a one-shot case study, right, if you just focused on community A. But when you add on that second group and then you see a reduction, and you add on the third group and you see a reduction, you can be more confident that that reduction is something to do with your program and not something to do with other aspects of the environment or the weather or pre-existing differences between groups. So this is a model that works particularly well when you're delivering community programs or delivering programs to the community that everybody needs to have access to. We're providing the pilot, sometimes providing the program only to one group is seen as sort of preferential, and we get pushback, well, we can't deliver the pilot, only make it available to a small segment of the population because then we're leaving out others who don't have access. So this allows you to pilot test while still delivering it across the broader community. So the last concept I want to cover with regard to pilot testing is calculating return on investment. And if you look in Doug Mackenzie Moore's book, or you look in the social marketing book put together by Nancy Lee, there's a couple of different ways to do this. But what I'm providing here is the most simple way to conduct return on investment and the most, I think, the most useful way. Other models look at things like costs avoided and social impacts. It gets a lot more complex and really hard to measure. But at the very basic level, everyone should be doing this level of return on investment calculation in a pilot test. And it really only needs 3 pieces of data. First, how much money was spent on the program? And this includes the development costs, implementation costs. So what does it cost to print, mail, maybe stuff envelopes? What is the staff time that is taken to deliver the program door to door? What are the incentive costs? So what are the staff costs for oversight and project management of the program? What are all of the dollars spent on delivering the program? And then B, how many behaviors were influenced by the program? So, looking at your treatment group, how many people engaged in the behavior because of the strategy? And then lastly, what you calculate here is what was the cost per behavior influence. So let's say for every tree that you got the community to plant, what did that cost in terms of program dollars? So I'll show you an example of why this is important and what it can tell you about broad-scale implementation. So looking at, say, 3 different pilots, 3 different strategies, strategy X, strategy Y, and strategy Z. So we'll say that each of those strategies were delivered to 10,000 people, and they had different costs associated with them. So again, cost is the dollars spent to develop and deliver the program. And so in this example, we have 3 different cost levels. Program X costs $4,000 to deliver to 10,000 people. Program Y costs $6,000, and Program Z costs $8,000. And then when we look at our results, we see some variability. Strategy X was the least effective, with only 8% of those 10,000 people reporting changes in their behavior. 12% of the 10,000 people changed their behavior with group Y, and with group Z, 15% changed their behavior. So let's just say this is trees planted. So let's say 8% of those 10,000 people planted a tree compared to 12% and 15% in the other. If you look at just the results by themselves, you would say, wow, strategy Z is the one that we should be implementing to everyone. The strategy Z is the one that we should be implementing because it was the most effective. But if you look at cost effectiveness, that may not be the case. So let's say if the percentage translates to the number of behaviors changed, so 800 trees, 1,200 trees, or 1,500 trees. But then when you divide that by the cost of delivering that program, what we find is that for each of those behaviors, so it costs $4,000 to get 800 trees planted, that's a cost per behavior change of $5. Whereas in the more effective program, that was a cost per behavior change of $5.33. So even though the other programs, the 12% change or the 8% change was less, I think I might have a calculation error there. No, I don't. Were more effective, the cost of delivering the program in the case of program X was less. So you can deliver a $4,000 program if you have, say, a $12,000 budget, you can deliver a $4,000 program 3 times further than a $6,000 budget. And so you will, with a cost, or an $8,000 budget. So with the cost of a behavior change is lower, it suggests that you can deliver it out across a wider part of the population. I'm just going to take a look real quick. I know there's a question in the chat. Comparison wouldn't really work unless behavior was the same. Yes, so you would be looking at the same behavior across each of the strategies. So the idea here is that each of these strategies are aimed at changing a particular behavior, and it might be changing different behaviors, but you would conduct this cost per behavior change around individual behaviors. Again, this can be difficult to evaluate, and there may be different levels of information. You may have to make estimates about cost, but it is helpful to look at the big picture across the strategies, because sometimes a strategy is more effective. If it costs more to implement, in the end, you're not going to be able to reach as many people. You're going to get more overall change delivering a less effective strategy to more people. And that's the kind of decisions that you can be making. And it also helps you to justify your program budget going forward. I know Katie will talk a little bit about that in a moment. So just to wrap up on pilot testing, a few things to keep in mind, just kind of 6 different points here. First, we never want to mix barrier and benefit research with pilot testing. And the reason for that, so that is we don't want to conduct barrier and benefit research with the same group that's going to be in our pilot test. The primary reason for that is the mere act of engaging in the barrier and benefit research can sometimes be enough to change people's behaviors. You've got, if you conduct a survey, say on tree planting or living shoreline, people are now interested, they're thinking about it, they're doing some research, maybe they're talking to their neighbors about the survey they participated in. And a proportion of those people are likely to change their behavior simply because they participated in the research. So if you then use those same people in your control group or in your pilot group, then you cannot ever separate out the impact of participating in the research from the impact of your strategy. So whenever possible, we want those people that participated in the research to be excluded from the pilot test. Also with pilot testing, as you saw when we walked through those designs, use a minimum of 2 groups so that you can make comparisons between a control group, even if they're pre-existing groups, that you can make a comparison between those 2 groups, your strategy group versus a group that does not get exposed to the program. And I showed you a number of different ways that you could set that up. Third, whenever possible, use random assignment. And again, random assignment eliminates those pre-existing differences that might exist between individuals by ensuring that they have an equal opportunity of being in the control group or the test group. Katie will talk a bit more about metrics in her section, but we want to prioritize measurements of behavior change. Again, if we want to calculate return on investment, we're most interested in whether behavior changed. Not necessarily, we might be interested in did people know more, did people care more, but we are mostly interested in was the strategy effective at changing behavior. Calculate return on investment for the reasons we talked about, both in making decisions about how to scale up, but also in justifying and planning your budget going forward. And then lastly, we talked about that feedback loop. So revising your pilot until it is effective, but also cost effective. So at times, you may find that your pilot, the cost of delivering the program might exceed the cost of just going out and doing the behavior for the participant. And so that's really kind of important consideration. So if delivering a tree planting program, for example, costs more than actually just knocking on doors and planting trees, then that's a really important consideration when thinking about how to roll out a program. So we want them to be effective at changing behavior, but we really need to be considering the cost effectiveness of those strategies as well. So at this point, I will turn it over to Katie to talk a little bit more about what do we do once we've got a pilot strategy that is effective and cost effective. Then what next? Thank you, Katie.
All right. Great. Thanks, Jennifer. So as Jennifer said, we are assuming now that we have successfully piloted. We've created a program that we've seen good outcomes from, that we want to put out in the field broadly. So what now? I'm going to talk a little bit about the differences between piloting and broad-scale implementation. How do you put together an implementation plan? What are the key things we want to have in there? And then a little bit about evaluation. So this is going to be a little bit technical. I'm going to try to focus more on the overview and understanding the concepts. As Jennifer mentioned, these are understanding what are the best practices, what are the key things to think about. You may or may not be able to do all of these elements in your program. It's still important to know about them so we know either what we're giving up by doing certain less costly, less time, resource requiring designs, using different kinds of evaluation, collecting different metrics, just at the very least to keep it in mind that what we're giving up by doing these trade-offs, as well as if we are hiring consultants or working with outside people, what we can do to make sure that we're getting the most for our money. Okay, so when we're thinking about broad-scale implementation, we're going beyond piloting and that we are working with a tested program. So now that we have done this pilot testing and understood what our program can do, what kind of behaviors it can change, what the results are, we now have a reduced need for a control group, random assignment. Those are the things Jennifer talked about. Again, when we're doing evaluation of our full group, it can still be good to have those elements. So if we want to do more in-depth evaluation, to be able to contribute stuff to our program, but since we have seen that it works, again, we're living in a world of limited resources, limited time, so those elements are most important when we're in the control group and looking to show that our program works and make decisions about what we want to move forward with. We also are more able to use broad advertising and implement a public event. Often when we have a control group, we are trying to keep them separate from the outreach elements. So we usually don't use things like broad advertising, social media, public event advertising and such, because we worry about our control group being exposed to those as well. Overall, we're really trying to increase our reach rather than moving from really that small pilot testing to a larger implementation group. So when we're putting together an implementation plan, you want to think about 4 key elements, which are the what, the who, the when, and how much. If you are a program manager, as many of those I know who are listening to the recorded version of the webinars are, you likely are familiar with how to project plan, put those kind of documents together. Your organization may already use specific resources or setups. We're not going to go really into depth on those. There's a lot of great resources on that. We just want to make sure that these 4 things are included. The first being, what key activities do we need to get from we aren't doing anything yet to a fully implemented and evaluated program? You know, what printing do we need to get done? What staff schedules do we need to coordinate? What door-to-door teams need to get out there? How long will it take them? The who is the implementers. So what partners do I need to have on board? You know, if we're doing tree planting, you might need to have a nursery that's ready to deliver a certain amount. You might need to have rental rooms set up, and you might need to have a particular number of staff available at certain times. The when is time frame. So how long does it take to get, you know, the material set off to your printer and get back to you? You can make sure that your program is implemented on time. You'll often pick up information about that while you're pilot testing and evaluating your pilot test. How long did it take us to get things off the ground? And how much goes back to that idea of return on investment, making sure that for each step of the implementation process, we have the right amount of budget set aside and staff time set aside so we don't get further along the line and go, oh, we spent all our money and aren't actually able to move everything forward. For the rest of the time, I'm going to talk about evaluation. These principles, of course, can apply to our pilot testing as well. I'm going to be framing them a little bit more in terms of the broad scale implementation, but of course, we're evaluating our pilot test as well as evaluating our broad program. So first, talking about definitions, what is evaluation? So the process of collecting, analyzing, and interpreting information about our program needs or our audience needs, about implementation, how well it's going, about the effectiveness of our program, and about the efficacy of our program, or efficiency of our program. Evaluation is a very important part of the process, but it's often skipped because it's a little bit boring and not as interesting, not as fun as putting together strategies and doing this kind of stuff. But to me, it's a very important topic because I want to make sure that my programs work, and I don't want money to be spent on things that aren't having the change that we want them to. So why do we evaluate? Often it's required by funding agencies. So if they're providing you a grant or similar money, they often require you to demonstrate that you have used their money wisely and have made a change with it. You can use it to justify your program existence. So why should our organization keep running this program, particularly when you're preparing for budget cuts? You can justify and say, my program has this level of an effect, we spend our money this efficiently, and have that data ready in front of you instead of just being able to say, well, people enjoy it. You can make changes. So if you run an implementation evaluation with your staff and they say, well, this form is really confusing, I can't figure out how to track things correctly, you can make those kind of changes, as well as Jennifer mentioned the larger strategic changes to the program. You can assess if there's any unintended effects. So perhaps there is wording in your outreach that was interpreted in a way you did not intend and is causing a reaction or pushback from your audience. You may, if you just looked at the, say, water data from your households, you may not understand why it didn't change, but if you do some level of survey research, you can understand, oh, it's that people read this sentence and had a really bad reaction to it. Cost efficiency, which we've already talked about a lot with return on investment, as well as informing future efforts of year 2, year 3, year 4 of your program, continuing to improve it as you go along. The biggest challenges we see with actually having evaluation on the ground, first, having sufficient resources, as mentioned in the implementation plan. You want to make sure you set aside funding for everything you want to do. And often, since evaluation is thought of last, it gets kind of the end thought of funding and doesn't get properly funded. But it's really an important part of the process, so making sure that you set aside some amount of your budget for it. Designing effective data collection tools can be a challenge. We talk a little bit about this in webinar 2, about how you design research tools. If you're working on smaller scale things from an internal budget, you can also, of course, work with consultants or universities for assistance with that. The third is gathering actionable results, so making sure that we are gathering data that we can then use to improve our program, as opposed to data that ends up sitting in a repository and never used, or just pile of surveys sitting on someone's desk and never looked at again. As well as completing data analysis. There's certain skill sets go in that you may or may not have in-house. So one of the ways that we avoid some of these challenges is going into evaluation with a plan. So the first thing we want to think about is, what is the purpose of this evaluation? What decisions will be made of as a result? So when we're thinking about that challenge of actionable data, we want to think about, what are we able to change? What do we want to change? And think about what we want to know to be able to do that. If the focus is really on making the program more cost-effective to fit into a budget, we might evaluate differently than if the focus is more on justifying the existence in funding for, or justifying the existence for showing how much outcome or output it has. The audience for your evaluation results, the general public probably has different interests than your funders, your staff, your management, your board. So thinking about who is going to be reading these evaluation results can also help determine what kind of metrics you want to collect. You want to list out all the different potential sources of information you can gather, such as, are you able to survey your audience? Is this the kind of behavior you could observe, such as seeing what people put out on their lawns? Are there meters, such as electric or water use? Can you solicit various databases like permitting to understand if people have taken out permits for living shorelines, if people have potentially talking to contractors or the third parties in audiences to see, did people call in to get armor removed from their shoreline? Looking at what are all the different ways we can potentially collect data on this. And finally, thinking about what time and resources we have for evaluation. So making sure that we're realistic to keep some money aside and also not plan to do some giant, survey and interview every single audience member, which is way beyond the budget we would be able to provide. So there's 4 different types of metrics that you can think about when you're conducting your evaluation. Typically, most evaluations focus on just the inputs and outputs. We really want to encourage you to think about the outcomes and impacts. Is that where we're really getting at the meat of, did we change behavior and did we have an environmental impact? So your inputs are what resources are used to develop, implement, and evaluate, from money, staff time, partner contributions. Again, coming back to the idea of ROI, how much are we investing in this program? For outputs, these are the measures that quantify your outreach activities. So how many materials did we distribute? How many people did we reach? How many media impressions there were? And how many completed activities did we do? And these are both important things to collect, important things to know. We need to know these things to help track our budgets, understand what happened, and all these things. But we, whenever possible, want to make sure that we go beyond those and think about things like our outcomes, which are measurable responses to our outputs, such as changes in behavior, in the audience knowledge, in attitudes and beliefs, behavioral intentions. The behavioral intentions are important for behaviors that the audience may not be able to engage in the time frame that you're evaluating in. For example, if you wanted them to invest in a more energy efficient home, they're likely not going to make that home purchasing decision within a short time after your outreach, but you can measure instead their intention to do so and see if that has changed. Things like campaign awareness, policy changes, new partnerships. You can use tools such as surveys, observations, if it's a observable behavior, any other techniques that we've mentioned before, depending on the specific behavior you're looking for. But really trying to, whenever possible, assess, did we change the behavior that we denoted in step 1, that we moved through with step 2, that we designed a strategy for in step 3, and piloted 4 and 4? Are we seeing those changes in our pilot tests and in our broad scale implementation? For our impacts, this is the impact that our outcomes have had on our goal. So again, you may remember way back in step 1, we talked about what goals do we want to do, what affects the problems that we're interested in. So this might be pollutants in our waterway, this might be habitats that need to be protected, species saved, water supply, air quality. Depending on the scale of the program, we may or may not be able to measure those, but whenever possible, it's important to look at, have we had the impact that we're looking for? Because when we take this program through the CDFM process, you may remember we talked about one of the metrics of behaviors that we chose was whether they had an impact on the environmental goal that we're seeking. So we selected behaviors because they were having an impact on these environmental goals that we were looking at. So when we come to the end, have we had that impact that we were looking for? Whenever possible, it's good to triangulate your evaluation. This is why back in our plan, we listed out all the different potential resources we could use, which could include observations, existing records, qualitative research, talking to participants with interviews, surveys, be they mail, phone, intercept, real-time meters such as energy, water, and various others such as looking at permits, other ways that you can measure your behavior, because these can help tell a story of what really happened and help balance the pros and cons of these different methods. So for example, in a program we've done on water conservation, where we were trying to get people to reduce household usage, we saw a very strong correlation between our survey results and the actual real-time meter. The people in our treatment group who had reduced usage on their surveys also reported the same reduction while the control group didn't, which really helped tell the story of people were doing the action that we were seeking for them to do. That's what the water use was attributed to. If we had just had the water data, we could make an assumption that that's what changed, but with the survey data along with it, we actually knew that they were doing we were able to more strongly say we can know that people are doing the action we're seeking. Conversely, when you look at food waste behaviors, people are often very different from the waste audit of their trash to what they report in the survey. This is due to a lot of different things about how people remember activities, asking people about things they do in their everyday life on a daily basis with food versus larger water use behaviors. But again, helps tell a story of people are not as cognizant about their food waste and those kind of behaviors and what's going in their waste audit. So either way, whether those sources support each other or not, helps us tell a story and helps us understand different approaches that we may need to take to promote behavior change. There's 4 different parts where we may evaluate. The first is the baseline. Jennifer talked a lot about knowing about pre-existing differences. During is tracking and monitoring. So this may be where you're evaluating more with your actual process of implementing. Are there things that went wrong, things you may need to improve next time? You need to get certain permits you weren't aware of. You need to get certain more staff time than you realized. After the post-campaign and the follow-up, this is where you're looking at your outcomes and your changes in your environmental inputs. You're changing your environmental nutrient reductions, other things like that, to see if that changed due to your program, and follow up in the long term, did that behavior sustain, as well as did it continue for year 1, year 2, year 3, year 4 implementations of your program. The last is data analysis. Very briefly, if you're looking in-house to do analysis of your evaluation of simple surveys and things like that, you're going to be looking for resources related to descriptive statistics. So this is means, frequencies, percentages, things you can easily calculate in using functions in Excel. You can also look up content analysis. This is where you're doing qualitative research, interviews, and looking for themes. If you are trying to do more inferential statistics, which is where we're getting into ANOVAs and t-tests, you likely need to go external, either hiring consultants or a partnership with a university or groups like that to help you run those kind of results. So our additional resources today, of course, first Doug's book and Nancy Lee and Philip Kotler's book on social marketing and sustainable behavior. On the web, cdsm.com and toolsofchange.com have great case studies, forums, and such for you to discuss these kind of things. There's 2 websites here specific to the sample size and random assignment pieces. A random selection that Jennifer mentioned to help you make those things is we may think we can do random selections, but things like if you randomly select, sometimes the numbers very close to each other and our brains can't process that very well. So it's really good to use these tools. They're free to use, pretty quick, very simple to understand. I use random.com all the time as a grad student, very helpful. And now the Q&A. And I have seen the lost where the chat box is. There we go, chat.
Thanks so much, Katie. And Jennifer.
Great, thank you.
I see a comment from Sally in the chat box, but does anybody have any questions at the moment?
You can either take yourself off mute or put them in the chat box.
Hey, I'll go ahead and say something. This is Sally. I was tracking along really well, and I thought it was very well presented. The one part I wasn't so sure about. Let me see if I can remember what it was. We were talking, oh, I know you were saying, if it's not cost effective, don't do it, kind of a thing, which makes sense, like if maybe you can plant the tree for cheaper, so just do it without doing the whole social behavior. But we often say, that the contact or the education has value in and of itself. So, does it, and is it, can that be weighed in somehow?
Yeah, definitely. I think, yeah, probably, I should have clarified that it's helping you to make that decision programmatically about how you want to move forward. So if knowledge and awareness goals are important to maybe ongoing programs, so having people engage with your program and form identities that are relationships with your program may make you more successful in getting them involved in future programs that you might want to deliver. And in that case, there's definitely that added value of delivering the program. But in some cases, if really you're trying to get quickly to a water quality outcome, or depending on sort of your ultimate mission or goal, it may not be as important. So I think it's just important to have that discussion internally. One of the places where we see this is in energy efficiency. So they've found over and over again that the cost of getting people to sign up for home energy audits and then do these one-time actions related to energy efficiency, particularly the low or no cost energy efficiency programs, exceeds what it would cost to just do direct installs. So a lot of the programs have shifted to just saying, we're just going to come put in, LED lighting in your office. We're just going to come into your home and do weatherization and faucet aerators. It's actually, especially for those one-time actions, but for those one-time actions they're less concerned about are people learning about the importance of energy efficiency? Are they going to engage with later programs? So you can make that decision. If watershed awareness, knowledge, and program engagement are important, then certainly it makes more sense to do that public outreach.
Yeah, with those audit programs, it's like 1 to 3% of people, even if they call and mail and all this kind of stuff. So but as Jennifer said, it really depends on your entirety breadth of goals, which is why it's important to make plans and think about what is the purpose and what you're trying to achieve. Thank you.
This is Laura Catalno. First off, thank you all for these series of webinars. They've been amazing and helpful and wonderful, and I'm grateful for all your work on this. A question I have when I think through this process is it seems like a lot of work, and it seems like a lot of time, and it seems like it could be expensive. So I wonder if you all have a sense of that. Is there like a broad range you could give us to just put in context the amount of effort that you would expect to go into even a simple behavior?
Yeah, I mean, it does add costs. Like I said, I think and there is no one answer for how much time and how much money you should be spending on pilot testing. I think that depends on what your overall budget is. So if you're working with a total project budget of $30,000, you don't want to be spending $10,000 on pilot testing and have no money to implement your program. But if you have $1 million budget or a $500,000 budget, then yeah, you should be spending a chunk of that budget on pilot testing. In our work, our pilot tests sometimes have had to be as small as setting up a table at a public location and randomly assigning people to view one set of materials or another set of materials, and then measuring their behavioral intentions. And that has to be done in an afternoon. So or can be done in an afternoon. So maybe it's not as ideal as implementing those same materials actually out in the community. Maybe they're door hangers, for example. So ideally, you would randomly assign households to get the materials or not, and then measure did their behavior actually change. But we don't always have that luxury. So you could do that, like I mentioned, in that field setting where people are randomly assigned to view just generic materials or specific program materials, and then ask the same follow-up questions. So I think you just kind of have to think through what your resources are, what your behaviors are. But I think in all cases, doing some type of pilot testing can provide really, really valuable information about the efficacy of your program or the potential efficacy about your program before you roll it out broadly. And in that way, it saves you money because you don't, picking up after a bigger mistake down the road, you've already developed all your materials, you've already deployed broadly, and then, you get a couple of phone calls, well, I don't like the sad face on these materials really, is offensive to me or makes me not want to participate. Very simple things are very hard to correct once they've been deployed broadly across the community. So, Katie, do you want to add anything to that? I know you've done a lot of pilots with varying size communities.
Yeah, so just to check on the question, was that specific to pilot testing or thinking about the whole process?
I guess both. It's pilot testing seems like it could be one of the more intensive steps, but I would be curious from just beginning to ready to do broad scale implementation, what's the effort required for that? I know it depends on the behavior and so many variables, but it seems significant.
Yeah, so Jennifer and I exist in this interesting space of in between academia and field, where we spend a lot of time trying to take best practices and figure out how you can apply them in field context and within a variety of resource constraints and challenges. There definitely are time components to it that each of these things can take a while. You can find ways to reduce the time and resources if For example, on a lot of these websites, and if you reach out to Jennifer and I, we can direct you to different resources that some of this work has been done for different actions already. So looking at what behaviors are most impactful. In some instances, you may only have a very small list of actions that are even able to be done. So once you go through the exercise of what actions impact the environmental outcome we're looking for, you may only end up with a list of 2 or 3, and then you don't really need to spend much time prioritizing. In that initial process, you can move on to what are the barriers and benefits, because you could do research on 2 to 3 actions in one effort. There's also ways, and I think we had some of this in webinar too, and I think you talked about it somewhat in the overview, but we can also include it more if it's not, on how to do your behavior prioritization inside of your barrier benefit research as well, to find efficiencies there. I don't know if, Jennifer, you have kind of a cost range you'd put on doing a program like this. I'll throw the hard one to you.
Yeah, I don't. I mean, there's so many factors, I think, that go into it that just putting a cost range is difficult. If you're looking to save costs for any sort of research effort, I think there's a lot of opportunities potentially with partnerships with universities, graduate students, people who might be willing to take on some of this as research or coursework. Community groups, we've used volunteers before to help with data collection, conducting observations. And so, for example, we did some work with coastal businesses related to water use behaviors outdoors, and it just, to get the measurements that we needed people on the ground coding the presence of water and observing behaviors. And so volunteers that were normally engaged in beach cleanups signed up to participate in this, almost like a citizen science effort in a way. And so that's a way to save costs and still be able to get data that you need to inform or to evaluate the program. And I think, at a bigger level, and I think we're starting to see this, is that funders need to start putting funding for evaluation and for pilot testing. And I know sometimes pilot testing is skipped because the grant timeframes or the grant funding, the way the grant funding is allocated, doesn't allow for it. And then it puts people in kind of a tough spot. But we do see that changing more and more. We see funders delivering these types of grants or awards in phases. So you're demonstrating that your program is effective before you're given, money for further implementation. So I think hopefully that would, open up some more doors for people to be able to follow through with this process.
Great, thank you.
Yeah, great question.
Does anybody have any other questions? Okay, well, Katie, Jennifer, thank you so much for taking us all on this journey over the last 6 months. So I know it's definitely been informative, for me, and I've heard feedback from other folks as well. This webinar should be up on our communications work group page, hopefully by the end of the week. The rest of are all there. Please feel free to go back and refresh yourself, rewatch, share them with anyone. And Katie, Jennifer, you guys amenable? If anybody has a question, could they reach out to you? Great.
Absolutely.
Yep. All right. Well, thanks everybody for joining us today. I hope everybody's staying healthy and safe and sane out there, and hope to see everybody in person again soon.
Yep.
Bye, you too. Thank you.
Everyone.
Bye. Thanks, guys.
Bye, everyone.